Hello friends, today's topic of discussion is inhibitors of protein synthesis or inhibitors of translation. This is important short answer question and it is important topic for MCQs. So there are number of inhibitors for the translation process in prokaryote, in eukaryote and in both. Okay. So you may get BAQ on this topic. Enumerate the inhibitors of protein biosynthesis or enumerate the inhibitors of translation process. So in prokaryotes, in eukaryotes and in both pro and eukaryotes. So it includes mainly tetracycline, cyclines. It also includes doxycycline and group, then chloramphenicol, erythromycin and aminoglycosides. Eukaryotic inhibitors includes diphtheria toxin, then ricin and cycloheximide. This is important MCQ, inhibitor of both prokaryotic and eukaryotic translation process. It includes puromycin. So these are the drugs which are used in the treatment of various diseases. They inhibit the translation process by binding to the smaller or larger unit of ribosome and blocking the translation process. Okay, so we'll see one by one. First we'll see the tetracycline mechanism of action. So tetracycline, it binds with the 30S ribosomal unit and prevent the attachment of amino acid tRNA to the A site. This chloramphenicol, it binds with the 50S ribosomal unit, inhibit the activity of peptidyl transferase. Erythromycin binds with the 50S ribosomal unit and it prevents the translocation of tRNA to the P site. Then aminoglycosides, it blocks the initiation process. It binds with the 50S ribosomal unit and blocks the initiation of translation process. This diphtheria toxin, it causes the ADP ribosylation of eukaryotic elongation factor 2 and inactivates this factor. This ricin binds with the 60S ribosomal unit, cycloheximide binds with the 60S ribosomal unit and inhibit the peptidyl transferase activity. Puromycin, it is a structural analog to the tyrosinyl tRNA and it blocks the or it causes the premature termination of protein synthesis. So this is in short the mechanism of action of various drugs. Now we'll see one by one. Okay. Now the first one is the tetracycline. Doxycycline. Okay. This drug attaches to the 30S ribosomal unit in prokaryotes and prevent the binding of amino acyl tRNA to A site. Okay, suppose this is ribosomal unit. This tetracycline attached to the 30S ribosomal unit and prevent the binding of this incoming new tRNA. prevent the binding of this incoming tRNA to this A site at the 30th ribosomal unit. This is the site of action. Okay, so it prevents the binding of this incoming amino acid tRNA to the A site. Okay, so this is the mechanism of action of tetracycline, doxycycline. These are the broad spectrum antibiotics specially used for atypical pneumonia, rickettsial infection, H. pylori infection, then in the treatment of syphilis. So it is a broad spectrum antibiotic and it is used for number of diseases. Second important is chloramphenicol. It is an antibiotic which is used in the treatment of enteric fever or typhoid fever, also used in the cases of meningitis. What is the mechanism of action of chloramphenicol? It binds with the 50S ribosomal unit. It binds with the 50S ribosomal unit, this unit, and it inhibits the peptidyl transferase activity. What is the activity of peptidyl transferase? Formation of peptide bond. So suppose this is peptidyl tRNA with amino acid chain, and this is amino acyl tRNA with new amino acid. So there is bond formation between these two amino acid. Peptide bond formation will occur between these two amino acid, and this is the site of action of chloramphenicol. It inhibits the peptidyl transferase and blocks the translocation, and it blocks the elongation process. So this is chloramphenicol. Then third important drug is erythromycin. It is important drug in the macrolide group. It is useful in the lower respiratory tract infection as well as upper respiratory tract infection. Erythromycin, it binds with the 50S ribosomal unit and it blocks the attachment of peptidyl tRNA to P site. Blocks the attachment of peptidyl tRNA to P site. So this is amino acyl tRNA. Okay, and after the elongation of peptide chain at this site, so we'll see that. So this is peptide chain, elongated peptide chain. This is peptidyl tRNA. Now this peptidyl tRNA will move to this P site. This is at the A site now, and this site should be free for the new incoming tRNA. Okay, so it prevents the binding of this peptidyl tRNA to this P site. Okay, this is the mechanism of action of erythromycin. It is mainly used for upper and lower respiratory tract infection. Macrolide belongs to macrolide group. Binds to the 50S ribosomal unit and blocks the attachment of peptidyl tRNA to the peptidyl site, P site. Okay. The next one is the aminoglycosides. It includes mainly streptomycin, which is an important drug in the treatment of tuberculosis. It is important drug in the treatment of tuberculosis. then gentamicin, neomycin, amikacin. These are the aminoglycosides. Okay, so neomycin, it is used for local infection. Gentamicin, amikacin, these are used for the gram-negative infection caused by the gram-negative bacteria. So aminoglycoside antibiotic, they attach to the 30S ribosomal unit. They prevent the formation of initiation complex. They causes misreading of mRNA. Also they blocks the translocation. of ribosomes. In this way, this aminoglycoside antibiotic will act. Okay, so this is prokaryotic inhibitors of translation process. Now coming to the eukaryotic inhibitors, it mainly includes diphtheria toxin. It is produced by the Corynebacterium diphtheria, which causes the infection in the nasopharynx. Okay, it causes the infection in the nasopharynx. So this diphtheria toxin, it causes ADP ribosylation of eukaryotic elongation factor 2 and inactivates this factor. This factor is required for the ribosomal translocation of ribosome. So it will block the elongation process in eukaryote. This is important MCQ. Diphtheria toxin will causes ADP ribosylation of eukaryotic elongation factor 2 and inactivates this factor. Okay, so it blocks the translocation in eukaryotic translocation of ribosome. Okay, then next one is the ricin. It is a protein from castor beans. So it is the castor oil, it is used to relieve constipation. So ricin, it binds with the 60S ribosomal unit and it removes adenine nucleotide. From 28S rRNA. It binds with the 60S ribosomal unit and blocks the translation process. So ricin, diphtheria toxin, and next important is the cyclohexamide. It binds with the 60S ribosomal unit and blocks the activity or inhibit the activity of peptidyl, eukaryotic peptidyl transferase. Like chloramphenicol, it binds with the 60S ribosomal unit and blocks the activity of peptidyl transferase. So it blocks the elongation process. Now the important one, puromycin, which is a prokaryotic as well as eukaryotic inhibitor. Okay, we'll see the puromycin. It is an important MCQ, that is puromycin inhibits both prokaryotic and eukaryotic translation. It is structurally similar to that of tyrosinyl tRNA. So it is incorporated in the translation process. So it involves in the protein synthesis, involves in the translation process, incorporated into a growing peptide chain and causes premature termination. Premature termination of protein synthesis. So this is puromycin, structurally similar to that of the tyrosinyl tRNA, incorporated into a growing peptide chain and causes premature termination of translation process. So this is mechanism of action of puromycin. So you may get a short note on this topic, you may get a BAQ, and there are a lot of MCQs from this topic which are generally asked in the entrance examination. So this is all about the inhibitors of protein biosynthesis. Keep watching. Thank you.